Good afternoon, everyone. Can you hear me in the back? I can see a thumbs up. I can see a thumbs down. I can see confused looks. A little bit of everything. Well, welcome. Once again, we're all together. I'm Alan Morgan, Chief Executive Officer of the National Rural Health Association, and I want to welcome you all to our 2023 Rural Health Awards banquet. You know, we take this moment to spotlight the unsung heroes who work behind the scenes to seek out every possible avenue to make life better, healthier, and more compassionate for all rural Americans. Today, we are pleased to also recognize the top 20 rural and community hospitals. We will learn more about those hospitals a little later. I'd like to take this moment to thank our student award sponsor, John Snow Incorporated. We so appreciate the vital contribution that John Snow has made to NRHA and to the future of rural health through support of our two outstanding student recipients. NRHA is delighted to welcome Jide Bamishima of JSI, who is in attendance today. Jide, can you please stand and be recognized wherever you are? There, thank you. Oh, there he is, on cue, walking in. Thank you, Jide. Appreciate that. I'd also like to thank our panel of judges who gave their time to fully examine all the nominees to select the stellar recipients. They did an outstanding job looking through an amazing a selection of applicants. And lastly, thank you to all of you who have nominated a candidate this year. There were many worthy nominations received, and there are numerous people and organizations among our ranks making a difference in rural health. So I encourage you all, please keep nominating these champions. It is now my pleasure to introduce NRHA's Chief Operations Officer, Brock Slabaugh, who will recognize NRHA's top 20 rural and community hospital winners. Brock?
Thank you. Well, good afternoon, everyone. And it's great to be here this afternoon as we celebrate the awards that we're about to give. Of the approximately 800 prospective payment systems hospitals in America today, we will recognize those hospitals that have set the highest standard across 8 different pillars of excellence. Those pillars are inpatient market share, outpatient market share, quality, outcomes, patient perspective, cost, charge, and finance. These hospitals have achieved success with an overall composite score encompassing all 8 pillars, and these are NRHA's top 20 rural and community hospitals. I'd like to thank the Chartist Center for Rural Health for their work in compiling the data for NRHA's top 20 rural and community hospital award. Troy Brown of the Chartist group will now come and offer some perspectives on the importance of this award.
Good afternoon. Our team at the Chartist Center for Rural Health is thrilled to celebrate and recognize the 2023 top 20 rural and community hospitals. These facilities are not only surviving, but thriving during this unprecedented time of rural health vulnerability. Unfortunately, as we have seen this week, we continue to see a widening in health disparities between our rural populations and our urban counterparts. Specifically, we are seeing a reduction in patient access to healthcare services, including primary care and mental health services, and an increase in premature death rates. In fact, in 2019, the mortality rates for the top 10 causes of death, including heart disease and cancer, are all higher in our rural communities. And unfortunately, we have also seen a surge in deaths of despair throughout the pandemic period, including overdose deaths, alcohol-related deaths, and suicides, including those of our veteran populations. Although we had a brief reprieve from the rural hospital closure crisis during the pandemic due to an influx of provider relief funds, we are back on track to meet or exceed the pre-pandemic closure rates. Provider relief funds also have helped to prop up operating margins, with only 43% of hospitals operating in the red through 2021. But current financial performance is quickly dropping back to those pre-pandemic levels, where nearly 50% of rural hospitals were operating in the red, with approximately 453 hospitals identified vulnerable to closure. These financial pressures have contributed to the further erosion of service lines within our rural communities, with 217 rural hospitals closing their OB units between 2011 and 2020, and 353 hospitals ceasing to provide chemotherapy services between 2014 and 2021. Our long-standing staffing issues were further exacerbated during the pandemic, with nearly 40% noting staffing issues had prevented inpatient admissions, and nearly 20% noting a temporary suspension of some service lines during the period. A glimmer of hope for some is the new rural hospital emergency status that will allow some sort of relief for some of our smallest volume hospitals. But it is certainly not a long-term solution to our long-standing instability. Although this new status will allow for continued outpatient services in your community, this can be seen as a further erosion of services to our most vulnerable communities, with the elimination of inpatient care and, most importantly, swing bed care. Taking into account the varying factors associated with this licensure change, including loss of 340B and cost reimbursement for corporate allocations for critical access system affiliates, our team modeled approximately 80 facilities that would perhaps benefit the most from this transition. So enough of the gloom and doom. Let's celebrate these facilities that, again, have not only survived, but thrived during this tumultuous time. Geographically, these hospitals can be found from coast to coast, north to south, with Utah having our greatest number of recognized hospitals for this year. Go Utah. These top 20 hospitals have excelled across all 8 pillars of the Chartist Rural Hospital Performance Index, surpassing their peers in all areas, including market capture, the value of services offered, and overall financial stability. If you're interested in seeing how your hospital performed in the Rural Hospital Performance Index, please reach out to me or any of our team members for a review. We would be happy to share those results. I will be hanging around after the awards ceremony down front here if anyone would like to connect. So with that, congratulations once again to this year's top 20. Thank you very much.
I will now announce the names of all the winners and then ask those representatives that are present to make their way to the platform for their recognition. The top 2023 Rural and Community Hospital winners are Alomere Health, Alexandria, Minnesota. Ashley Regional Medical Center, Vernal, Utah. Aurora Medical Center, Manitowoc County, Two Rivers, Wisconsin. Avera Queen of Peace Hospital, Mitchell, South Dakota. Brookings Health System, Brookings, South Dakota. Castleview Hospital, Price, Utah. Cedar City Hospital, Cedar City, Utah. CHI Mercy Health, Roseburg, Oregon. Evanston Regional Hospital, Evanston, Wyoming. Memorial Hospital and Healthcare Center, Jasper, Indiana. Methodist Hospital, Hill Country, Fredericksburg, Texas. Munson Healthcare, Cadillac Hospital, Cadillac, Michigan. Pomerene Hospital, Millersburg, Ohio. Prairie Lakes Healthcare System, Watertown, South Dakota. Pratt Regional Medical Center, Pratt, Kansas. Riverside Shore Memorial Hospital, Onancock, Virginia. Rolling Plains Memorial Hospital, Sweetwater, Texas. Sevier Valley Hospital, Richfield, Utah. SSM Health Monroe Hospital, Monroe, Wisconsin. UC Health Yampa Valley Medical Center, Steamboat Springs, Colorado. Many of these hospitals are represented here today. If your hospital is a top 20 winner, please make your way to the platform to introduce yourself and receive your certificate.
All right, good afternoon. My name is Wes Taylor. I'm the CEO of Asher Regional in Utah, representing Utah. Good job. And this is Amanda Billings, one of our respiratory therapists today. I'm grateful for the opportunity that we have to say thank you to all of our team members back home. And I'll just say top 20 in the country is an amazing award, but it's all of our staff that do everything every single day. In fact, I'm going to tell a short story about Amanda. Yesterday, we not only have the top 20 in Utah, on our plane when it arrived, an individual on the plane passed out, no pulse, not breathing. She resuscitated him. Thank you.
Awesome. Congratulations. Congratulations and thank you for that.
Good afternoon. I'm Cindy Wallace. I'm the CNO of Cedar City Hospital. And because of the more than 450 caregivers that we have at Cedar City Hospital, we've won this award 8 years in a row.
Congratulations.
Hi, I'm Angel Roundy from Sevier Valley Hospital in Richfield, Utah. And I want to just thank all of our caregivers and our system for all the support and all the great work they do. Thanks.
Thank you. Congratulations.
Hello, I'm Shelley Turbeck. I'm the Chief Nursing Officer at Prairie Lakes Healthcare System in Watertown, South Dakota. This is the 7th year we've won this award, and it's not without the hard work of all our physicians and staff, and I appreciate them all.
Great. Congratulations.
I'm Sherry Willard from Evanston Regional Hospital, Evanston, Wyoming. This is our first year receiving the Top 20 award, and it all goes to our amazing staff at our hospital making things run every day.
Thank you. Congratulations.
There's a lot of people. Hi, Peter Marinoff, CEO of Munson Cadillac Hospital in Cadillac, Michigan. Want to thank our team in Cadillac. Want to thank the healthcare system in Michigan for being supportive of all the efforts of the hospital. But I also want to thank organizations like NRHA, Michigan Hospital Association, Center for Rural Health in Michigan, it is these events that inspire us to be better community healthcare leaders, and it's just great to see everybody here collaborating. So thank you.
Great. Thank you.
Hi there. I'm Laura Sainert. I'm the Chief Medical Officer at UC Health Yampa Valley Medical Center in Steamboat. Obviously wonderful to be here. We have also received this as our second year in a row, and I think fifth in the last 10 years. So I'm also one of the ED providers, and I will say this is obviously a team effort. And I know the care we provide every day. I feel it, I live it in the ER, and I'm so proud to work at our organization. So thanks.
Oh, awesome. Again, let's congratulate all of the top 20 rural and community hospital winners, and it's great to have those here with us today. And now it's my pleasure to welcome back Alan Morgan to the podium to continue our program.
Okay, I am honored today to recognize those who have made rural health landscape a more welcoming, more effective, and more community place. Today's winners have worked tirelessly in their respective communities to ensure that rural Americans receive high-quality health care. These heroes make a huge impact. From a North Dakota physician who challenges colleagues to a higher level of excellence, to an educator in the rural Montana West, Mountain West, who brings insight and empathy to her students through her guidance and endless encouragements. This is a slate of experts, including researchers who provide critical data to rural policymakers, and a proven leader from Kansas who has made healthcare access easier in frontier areas. Today, we celebrate a program offering health screenings to the agricultural community of Eastern Oregon, where about 20,000 migrant workers flood to farms during the cherry harvest annually. We honor the efforts of an Illinois hospital representing the best in rural hospitals, providing elder care to the community in significant strides. Lastly, today we encourage the support of the work of two outstanding students who will advance rural health in the future. These meaningful endeavors represented by our award recipients serve as models for all of us. They challenge us to brighten our entire world. The individual awardees, notice how I did that, statuette, is a symbolic triangle representing three attributes that all of our recipients share: integrity, dedication, and service. The burst of color on the left refers to the diversity of talents offered in services to rural Americans. The organizational award plaques reflect the appreciation for the extra mile efforts of our distinctive recipients. During today's presentation, we invite you to applaud recipients at the end of each award category, or as he or she are presented with their commemorative gift. I would like to start right now by recognizing the winner of the 2023 Journal of Rural Health Article of the Year Award. NRHA and the Journal of Rural Health honor the most outstanding articles submitted to the Journal of Rural Health during the previous calendar year. The title of this year's winning article is Higher Hospitalization and Mortality Rates Among SARS-CoV-2 Infected Persons in Rural America. Writers for this work will display on the screen. Alfred Jared Alonzo is here today. Will you please stand and be recognized? Thank you very much. Next, it is my pleasure at this time to introduce NRHA President Leslie Marsh, who will present our Rural Health Awards. Leslie?
Thank you, Alan. Okay. Our recipient for the Outstanding Rural Health Program is the SOMOS program, which means serving Oregon and its migrants by offering solutions. With over 600 farms in Eastern Oregon, thousands of seasonal or migrant farm workers make up this agricultural workforce. The SOMOS program partners with local agencies to offer free health screenings and other resources for migrant families. Let's have a look.
SOMOS, Serving Oregon and its Migrants by Offering Solutions, is a program by Mid-Columbia Medical Center. This is Wasco County, along the Columbia River Gorge in the shadow of Mount Hood, which spreads over 2,400 square miles. Agriculture is a large part of the economy, making up 10% of Oregon's fruit, tree nuts, and berry cells. With over 600 farms farming 1 million acres, we have over 20,000 migrant workers every summer.
And what do those migrant workers mean to your farm operation?
Everything. The events that you've had over the years with the diabetes and all the information has always been well responded to and appreciated by all of us.
Is there anything you think we can do more as a society to support our migrant workers?
Just realize how hard they work and just say thank you every day for what's on our table. And yeah, support them and make sure that they're well taken care of.
SOMOS centers around the cherry harvest, an intense, focused harvest season that brings about 5,000 migrant workers in for 3 to 4 weeks between June and August, depending on the weather. Mid-Columbia Medical Center is a nonprofit community healthcare system serving a rural population and is the largest employer in Wasco County. SOMOS partners with local orchard owners, local community partners such as a migrant health center, dental clinic, health department, community outreach partner that focuses on family and youth services, and our inpatient and outpatient clinics to offer free health screenings and other resources. Our volunteers also are a big part of our success. Now, here's Jasmine to explain why it's her passion.
SOMOS is very important to me because my dad's a farm worker and he has been his entire life. And he migrated when he was younger to different locations. So SOMOS is offering basic health screenings to migrant and seasonal farm workers. So when we offer these services, I think about my dad and I think about how crucial and essential the health of farm workers are. And that's why I do SOMOS.
A goal of SOMOS is to create a fun, festival-like atmosphere with family activities and dinner that the migrant families and the volunteers want to participate in. Now, here's a thank you from our CEO.
Well, my name is Dennis Knox, and I am President and CEO of Mid-Columbia Medical Center. I want to thank the association for this national award. And I want to thank our Board of Trustees for making this a key initiative of our hospital, as well as the community partners that serve with us, and especially the great, outstanding team at Mid-Columbia Medical Center that make this happen.
The project leader for the SOMOS program is Jasmine Wila Flores, who is with us today. Join me in celebrating this amazing program. The NRHA John Snow Incorporated Student Leadership Award winner is Zachary Strecker. Zach is a third-year medical student at the University of Massachusetts. Let's find out more about Zach's efforts and experience.
Hello, everyone. My name is Zach Strecker, and it's such an honor to be selected for the 2023 National Rural Health Association and John Snow Inc. Student Leadership Award. First off, congratulations to all of the other awardees today. It's truly humbling to be recognized alongside these incredible people. So just to give some background on me, I'm originally from Cohasset, Massachusetts, which is a town just south of Boston. My first introduction to rural medicine came during one of my undergraduate classes called The Quality of Healthcare in America, during which I was pretty surprised to learn about the disparities in access to healthcare resources and provider shortages happening in this country. particularly those affecting rural communities. The fact that this was happening in a nation with such vast healthcare resources was really troubling to me, and I found myself wondering why these issues weren't more of a priority. So, during my medical education at UMass Chan, I wanted to get more involved, and I enrolled in the AHEC Rural Health Scholars Pathway, as well as the population-based urban and rural community health track. These two programs provided me with so many formative experiences working alongside rural providers, like my family medicine preceptorship in Barre, Massachusetts, my summer working in a primary care clinic in Franconia, New Hampshire, and my ongoing telehealth equity research with Outer Cape Health Services. For the past 2 years, I've also volunteered at the New England Rural Health Association, and during their annual meetings, it's been so exciting to learn about the innovative projects and solutions that are coming out of rural communities in my area. Throughout all these experiences, I've been so amazed by the dedication, resilience, hospitality, and above all, the kindness of folks that I've met along the way. During my second year of med school, I was selected to be one of the student leaders of the UMass Rural Health Scholars Pathway, along with my co-leader, Sarah Uranowski, and together we worked to offer similar rural health experiences to the next generation of UMass Med students. Time and time again, these experiences have truly recharged my love for medicine. They've shaped my development as a physician and continue to motivate me to serve rural communities in my career. These rural clinical experiences, I believe, really cemented my interest in rural practice, and I think they're such an important tool for recruiting future rural providers. I want to thank a few people today, starting with Andy Lowe, the director of the New England Rural Health Association. Andy, thank you so much for your nomination. This award means so much to me. Andy really made everything possible with the Telehealth Equity Project. He connected me and my classmates with the wonderful folks at Outer Cape Health Services and many others in the New England rural health community. To Dr. Steve Martin, my longitudinal preceptor in Barre and a relentless advocate for his patients in his rural family medicine practice. He set such a great example for me as a physician leader. To Kirby Lisi from the Massachusetts State Office of Rural Health, she has gone above and beyond to make UMass Med students feel welcome in the rural health space, and she always teaches us just how much healthcare providers can learn from community-based organizations. Also, Dr. Suzanne Cashman and Dr. Nick Hodge, directors of the UMass Rural Health Scholars Pathway, who have been so dedicated to supporting this important pipeline for budding rural physicians. And finally, to my parents, Richard and Babette Strecker, who have been so supportive of me throughout my medical education, and who have just been such amazing role models to me for my entire life. Thanks again to the NRHA and John Snow Inc., and to all the rural healthcare providers and advocates out there. You all make such a huge difference in so many lives every day. Thank you.
Please join me in congratulating Zach Strecker. This year's Outstanding Educator Award recipient is Dr. Diana Scow. Dr. Scow is an assistant professor at Idaho State University. She co-developed a curriculum for an interdisciplinary graduate certificate in rural health. Her students leave her classroom feeling inspired and equipped to address the unique challenges and strengths within rural communities.
I am from a place of dirt roads and wild fields, where long distances span between modest houses. Houses with space in them and around them, overseen by big swaths of sky with enough clouds to keep you entertained. Warm Chinook winds and wildlife were part of my everyday when I was young. In late summer, I waited for the J.C. Penney catalog to come so I could order my school clothes. My center of being is the great Rocky Mountain chain. In my 53 years of life, I've made homes in Idaho, Montana, New Mexico, Utah, and Nebraska. These many places are connected by a great spirit that flies over the West, evoking for me what it means to be rural. It is that spirit that I carry into my work. That Rocky Mountain chain serves as my classroom. It provides photographs and stories for context. It offers up rugged terrain and transportation routes that must be crossed in the wildest of weather. It supports communities where people work, play, love, worship, and age. So what is done in that vast classroom of mine with so many students? We learn about rural and underserved communities. We work to keep healthcare providers in the region. We do research that has real results for real people in real time. We explore what it means to truly achieve rural health. Students choose projects that resonate deeply and guide their futures as caretakers of what is precious. That is the cultures, values, and hard-won life ways of those who not only live in, but are of the Western landscape. I am truly grateful for this award and for each and every colleague, collaborator, mentor, friend, and family member who helped me find and share my vision. Sincerely, thank you.
Dr. Scow is unable to be with us today, but we salute her efforts. This year's Outstanding Researcher Award recipient is Elizabeth Crouch. Dr. Crouch has published extensively on rural-urban differences across the lifespan, including a specialty in rural children's health. Her work has influenced other rural health scholars nationally. Let's explore Dr. Crouch's life and works at the University of South Carolina.
The winner of the 2023 NRHA Outstanding Researcher Award is Dr. Elizabeth Crouch. Dr. Crouch is an Associate Professor of Health Services Policy and Management in the Arnold School of Public Health and the Director of the Rural and Minority Health Research Center, both located at the University of South Carolina. She joined USC in 2013 after completing a PhD in Policy Studies at Clemson University. As a health policy researcher, Dr. Crouch examines health disparities among rural and other vulnerable populations across the life course, including topics such as adverse childhood experiences and Medicare utilization. Her work focuses on both policy and economics. Only 1 decade into her career, Dr. Crouch has garnered more than $7 million in competitive funding as a principal investigator. She has published nearly 100 peer-reviewed papers in academic journals and given approximately 50 presentations at scientific conferences. Her expertise has been sought through invited talks for the National Rural Health Advisory Committee and the Federal Interagency Task Force on Trauma-Informed Care. Dr. Crouch is an alumna of the Association's Rural Health Fellows Program and served 3 terms on the editorial board of the Journal of Rural Health. She is a member of the Board of Trustees, leading legislative efforts as the Rural Health Congress Chair. She advises rural-focused groups at both the national and state levels. In 2021, she was recognized by USC's Office of the Vice President for Research with the Breakthrough Star Award. Dr. Crouch is a committed rural health researcher and educator whose research has advanced the field while her teaching and her sponsorship of graduate students within the Rural and Minority Health Research Center has helped foster the next generation of rural researchers, says Jan Probst, former director of the center.
Thank you so much for this tremendous honor. There are many researchers I look up to in the National Rural Health Association family, and I'm so grateful to be part of this group. I accept this award with great respect and thankfulness for the mentors I've had along the way and continue to have. I'm thankful to be part of the National Rural Health Association's board, where I have learned from so many in the various roles I have been in. I want to recognize the many individuals who work with me at the Rural Minority Health Research Center, who share this honor. Without such wonderful friends and collaborators, this work would not be possible. The efforts of those at the center help to work towards eradicating health disparities between rural and urban residents. I particularly want to thank our Rural Minority Health Research Center team, Dr. Jan Probst, Dr. Payan Hung, Janie Godbold, Jennifer Browder, Gabe Benavidez, Dr. Melinda Merrill, Nick Yell, and the many other students and staff who have laid our foundation over the years. Without all of you all, this work would not be possible.
Congratulations to Dr. Elizabeth Crouch. Our next award is the NRHA John Snow Incorporated Student Achievement Award. We are happy to recognize Dr. Jennifer Davis, who just graduated from East Tennessee State University. Let's take a look at Jen's accomplishments.
Jennifer Davis is a student who has tended to her rural roots by choosing a pathway into medicine and becoming a student leader amongst her peers. Ms. Davis is a member of the Quillen College of Medicine's Rural Primary Care Track, a 4-year community-based experiential curriculum whose core goals emphasize community and rural culture. Jen embodies the qualities of rural leadership by serving as a champion for rural life and its betterment. Jen has volunteered for the Rural High School Medical Camp at ETSU, with the primary objective to recruit students from rural communities into medicine. Ms. Davis wanted to evaluate the impact of the camps and their ability to influence a rural student's decision to pursue a career in medicine. Ultimately, the study concluded that camp participation did have an influence on student decisions to pursue a career in healthcare. Jennifer would continue her passion for rural health research by overseeing the following projects focused on rural health outcomes: the Rural Health Women's Project, which created pamphlets targeted towards women's health preventative screenings; Perceptions and Effects of COVID-19 in a Rural Appalachian Community, which provided an overview of the effects of the pandemic on rural communities. She's a member of the National Rural Health Association Student Group, a Gold Humanism Honor Society president. She served as an intern at the Health Wagon in Central Appalachia. As a mentor for integrated grand rounds, she served as a rural scholar in the Tennessee AHEC Rural Scholars Program. She's a student leader that the Division of Rural and Community Programs at ETSU has repeatedly called upon to lead the charge for rural, to mentor her classmates, and to showcase our mission, which is to educate future physicians, especially those with an interest in primary care, to practice in underserved rural communities. So for those of us here at Quillen College of Medicine, East Tennessee State University, located in Johnson City, Tennessee, we'd like to congratulate Mrs. Jennifer Davis for winning the Student Achievement Award from the National Rural Health Association for 2023.
I'm extremely grateful to have been nominated and honored with the National Rural Health Association John Snow Student Achievement Award. I would like to say thank you to the rural and community programs at ETSU, Quillen College of Medicine, for all of the opportunities and support they have shown me over the last 10 years. Specifically, I'd like to express my appreciation for Drs. Mark Daliave, Jose Velasco, Joseph Lawrence, Owen Grove, and Reed Blackwelder. You all have shown an unwavering amount of support for my passions and interest in serving rural and underserved populations while being instrumental in my clinical education and self-growth. To Tommy Loudy and Carolyn Sliger, thank you for investing in me as a rural high school student. Without you, I would not be where I'm at today. I'm so excited to be here in San Diego with all of you to accept this award and to see how you are raising the standard for rural healthcare. Thank you again so much.
We congratulate Jennifer Davis. The Rural Health Practitioner of the Year Award is given to one who has so elevated the art of rural healthcare delivery that his influence has been felt on a multitude of levels. This year's winner, Dr. Joel Johnson, is a physician in Park River, North Dakota. Dr. Johnson's unselfish commitment to his patients, fellow clinicians, support staff, and community are exemplary. Let's hear more about Dr. Joel Johnson.
Dr. Johnson's role is so important in First Care Health Center because he is the sole medical director and MD in charge of all practice in our hospital. Dr. Johnson's daily practice is a reflection of why he is deserving for this award.
I think Dr. Johnson is very important to the community, and the community realizes that. He spends time at local community events, whether it's for the hospital or the ambulance or something. He's always there supporting the community.
He works countless hours and always puts patient care first, and his team is held to that same high standard.
I think Dr. Johnson deserves this award because he's been committed to taking care of people, the community, for over 27 years. He feels that taking care of his community is what's the most important thing. His patients always come first.
My name is Joel Johnson, and I'm a proud family medicine doctor from Park River, North Dakota.
The city of Park River is home to 1,500 people. Not only do I see my patients in the clinic, but we also catch up over high school sports in the winter and farmers markets in the summer. I'm going to be honest, it's hard for me to believe I'm in San Diego to accept an award for doing a job that I love. It's an honor to be the National Rural Health Association's 2023 Rural Health Practitioner of the Year. I share a similar story with many rural doctors. Why go into family medicine if not to take care of your own friends and neighbors? It's hard to believe I've been practicing rural medicine for more than 25 years. I've treated more ear infections in the clinic and read more EKGs in the ER than I could have ever imagined as a medical student. I can tell you I wouldn't trade my career for anything because 25 years later, I'm still caring for my friends and neighbors, and I'm still getting thanked with homemade donuts and handmade drawings for my patients, and I love it. Rural America deserves high-quality, local medical care. Yes, being a small-town doctor has its challenges. I can't tell you how much Diet Coke I drink to counter sleepless nights in the ER, but it's rewarding in a way that doctors in a big city will never fully understand. Some of my best days are teaching medical students and residents so these students can experience rural medicine, the ups, the downs, and the baked goods for themselves, so maybe one day they will choose rural medicine too. We all know that a successful career in rural medicine means I've gotten a lot of help along the way. I want to thank my family for their support. I know that I'm never on time for supper or vacations, but I couldn't do this job without them. I would like to thank everyone that works here at First Care Health Center. I also want to thank my nurses. Their compassion and skill sets are unmatched and allow me to continue to provide the best care I can to patients. My nurses can calm any patient with a phone call. They can work magic when it comes to getting a medication covered, and I know I couldn't do this job without all of you. Last of all, I want to thank my patients. You keep scheduling appointments, you trust me with your stories and your lives, and we still share a good laugh at Dairy Queen. Thank you.
We congratulate Dr. Joel Johnson as the 2023 Rural Health Practitioner of the Year. Thank you. Alan Morgan will come at this time to present the Volunteer of the Year Award.
Thank you, Leslie. Each year, the staff of the National Rural Health Association nominates and selects the NRHA Volunteer of the Year. The attributes of this person include a willingness to be of service whenever needed, a commitment to rural health, and active participation in NRHA. In addition, the Volunteer of the Year is the one who really has been gracious in the representation of NRHA in a variety of settings. This year, the NRHA staff has selected Kevin Bennett as NRHA Volunteer of the Year. Kevin has been a member of NRHA since his student days. He has served NRHA in a variety of ways, providing a prominent presence in NRHA leadership, the Journal of Rural Health Congress, and many other facets of the National Rural Health Association. Nominated by 3 NRHA staff members, Dr. Bennett is described as an all-around nice guy, always willing to help out NRHA staff at all of our on-site conferences. He presents at NRHA events. He has held multiple leadership positions and is always the go-to when our staff needs a rural advocate. Kevin is director of the South Carolina Center for Rural and Primary Health Care. He is a prolific author of research articles, and he provides a valuable contribution to every project he undertakes. He is a leader by example. We are excited that Kevin will be NRHA's president next year. Please join me in congratulating the 2003 NRHA Volunteer of the Year, Kevin Bennett. Okay, I'll now return the podium back to Leslie.
One of the best parts of being the president of NRHA is being able to honor an outstanding individual who has dedicated their time and talents to improving the health and well-being of others. With NRHA's President's Award, I had the pleasure of working with another of NRHA's impressive and world-class leaders, Donna Douglas, on the award selection process. I asked Donna if we were able to recognize someone working at NRHA, and she immediately knew who I intended to select. So without further ado, I would like to award Brock Slabaugh NRHA Chief Operations Officer with the 2023 President's Award. Brock is one of the brightest, kindest, most respected, admired, and adored thought leaders in rural healthcare. He truly cares about those NRHA serves, its members, and the people residing in rural communities. He wants everyone to succeed in carrying out their respective missions and goes to great lengths to ensure that we all have the information and resources to make the greatest impact on our rural communities. He helps to connect people to others across the nation so that we can more effectively network, advocate, and lead. His integrity, work ethic, skills, and vast knowledge make him an important stakeholder on national and regional quality, regulatory, legislative, and innovative committees. Brock was applying the foundational tenets of DEI before most had even heard that acronym used. These traits and qualities, particularly his respectful, kind, effective, and exemplary leadership, makes him a natural choice for the President's Award. I met Brock in January 2010 while I was completing an internship at NRHA. He graciously took me under his wing, although I'm sure I was annoying and a bit of a hindrance. I stuck to him like glue. I love learning, and Brock is a talented and patient educator. He became my role model and mentor. I credit him for playing a role in any of the successes I have accomplished. I could ask him anything, and Brock, the in real life Google, knew the answer. Moreover, he would follow up with references and/or resources to turn to for additional information. His humble servant leadership means those around him feel that they are contributing and making a difference, while Brock does not take the credit he deserves. I'm sure we all recognize that he set the stage for that successful contribution. That ability to motivate, support, and direct new and older learners as they strive to do their best in advocating, innovating, and leading their organizations builds confidence, extends and enhances experiences, and makes us more accomplished and effective advocators and leaders. Brock became not only my go-to person for most things, but also a great friend. He is just someone I wanted to become more like. His work in rural health is extensive. He was a rural hospital administrator for over 21 years and has served on the regional policy board of the American Hospital Association. Brock specializes in rural health system development that encompasses population health and the varied payment programs moving rural providers into value-based purchasing models. He's a member of the National Quality Forum's Measures Application Partnership, Rural Health Work Group, and serves on the board of directors of Accreditation Commission for Healthcare. I'm not alone in recognizing Brock's outstanding attributes. Brock was the 2015 recipient of the Calico Quality Leadership Award of the National Rural Health Resource Center, and he also received the American Society of Healthcare Pharmacists Board of Directors Award of Honor in 2018. I'm passionate about rural health, rural communities, policy, legislation, personal and professional growth, and purpose-driven work. When I met Brock, we had just enacted PPACA. We've since traveled down the rural health transformation road through the hospital closure crisis, ongoing, value-based care, COVID, workforce shortage, and predatory payer practices. We are now reimagining rural healthcare delivery with the implementation of the REH program and other innovative models. While the journey has been incredibly challenging with continued financial and regulatory stressors, I cannot imagine how much worse off we would all be without NRHA's strong, highly skilled, and effective team. NRHA and its members are all difference makers. Brock plays a key role in all of this, and it is an honor and privilege to extend the 2023 NRHA's President's Award to this illustrious thought leader and impact player. Congratulations, and thank you for your service, Brock. The Outstanding Rural Health Organization Award is presented this year to Memorial Hospital Association of Carthage, Illinois. No project is too big or small for Memorial Hospital to tackle. Let's explore the caring culture of this remarkable hospital.
In 1950, residents of Hancock County, Illinois saw the need for local health care and opened Memorial Hospital, hardwiring the spirit of community collaboration throughout our organization for 7 decades. We are an 18-bed critical access hospital with 7 rural clinics and 62 supportive living apartments at our senior campus. Inspired to support the community, we built the first small house concept memory care in Illinois, and most recently added child care. Our clinics offer comprehensive services, including a med spa and integrative medicine. The Community Health Needs Assessment identified opportunities that we responded to by adding behavioral health services, enhancing diabetes education with unique approaches featuring a teaching kitchen, and developing healthy living strategies for all ages through the KEY program. As empowered employees, we share our commitment to the service excellence culture with countless volunteer hours. Staff also take on leadership roles with ICANN, IHA, and more. We embraced the triple aim and became a founding member of the statewide Rural ACO. Inspiring future caregivers is a daily focus. We are honored to serve as a host site for AHEC, covering 17 counties in West Central Illinois. Students serve as rural health coaches and gain experiences through internships and clinical rotations. As the opioid crisis began impacting the local region, we were among the first to react, creating the Hancock County Addiction Coalition, providing parent and teacher education through the Hidden in Plain Sight travel display. The commitment of our leadership, staff, and community were tested like no other during the COVID-19 pandemic. Faced with higher acuity patients and transfer facilities at capacity, the staff went above and beyond to learn new skills to care for patients close to home, all while achieving a 5-star rating in patient satisfaction by CMS for the past 3 years. During the pandemic, our community stepped up to care for us through the Caring Back Club with generous donations to Memorial Hospital Foundation. Through the spirit of community collaboration, visionary leadership, and passionate employees, Memorial Hospital is dedicated to providing innovative, inclusive, quality health care now and into the future.
We welcome Ada Bear, CEO, and members of her exceptional staff who will accept with this award. The Louis Gorin Award for Outstanding Achievement in Rural Healthcare is one of the most meaningful awards presented and recognizes one who has reached out to rural Americans in creative, unselfish, and compassionate ways. This year, NRHA is recognizing Robert Mosier, MD, also known as Dr. Bob, who is a primary care physician in Tribune, Kansas, before heading the Kansas Center for Rural Health at the University of Kansas School of Medicine. Through his numerous contributions, he has impacted rural medicine in Kansas to increase access for all patients in frontier areas.
I have known Dr. Mosier for about 35 years now. We started out together in the Kansas Academy of Family Physicians, and that's where I first met him as the representative from his district for Tribune, Kansas. He provided emergency services, hospital services, outpatient services, and obstetrical services.
This man has lived the life of a rural individual, not just a doctor, a rural individual. And so he understands from the ground up the problems and disparities that occur in rural life.
He really understands where they're coming from in terms of managing patients in the clinic, in the hospital, being a resource to the local community.
The governor appointed him as Secretary of Health and Environment. He helped to privatize Kansas Medicaid, which has shown to be a cost saver, but also to increase access to care. Subsequently, they looked at access time to care for heart attack and stroke in rural Kansas.
We saw that there were higher mortality rates for rural Kansans if you had a heart attack or stroke, higher readmission rates. The Kansas Heart and Stroke Collaborative, which is now known as the CARE Collaborative that the University of Kansas Health System helped start back in 2014, is basically taking out evidence-based guidelines and working with our rural providers and health systems to put those into the local realities.
But of course, people were wondering, why is the academic medical center now coming out across the state? And Dr. Mosier was really able to build that bridge because he had trusting relationships with so many of the providers all across the state. And today, we have 81 members across 72 Kansas counties, roughly 2/3 of the state of Kansas.
He wasn't done yet. The chancellor asked him to lead up a committee to really look into rural medical education.
My goal was, how could we produce more physicians looking to do primary care and to do that practice in a rural setting? Why not have a 4-year branch campus in Wichita and a 4-year branch campus in Salina? The School of Medicine took on that proposal.
Highly successful. It's in its 13th year. The graduates are about 3/4 of them are in rural practices. So it's really served its purpose.
What is the legacy of Bob Mosier for rural Kansas? As things play out, I think will have founded the future of rural medicine for the next century here in Kansas.
He really has built an infrastructure that will continue for decades.
I think Kansans should really take a look in those rural communities, and they'll see folks that are truly dedicated to the mission of providing good care and support for better health in our rural communities. I think it's amazing work that is being accomplished and needs to be respected.
We congratulate Dr. Robert Mosier as a 2023 Louis Gorin Award winner. Thank you. And this concludes our awards banquet. Again, congratulations to all winners.